Participating in this event, all attendees acknowledge their consent of this taping and agree for its later use. All recordings will be posted on MCOA's website as determined by MCOA staff. If you have questions, please submit your questions through the chat option button at the bottom of your screen. So we are pleased to have our good friend Jan Mutchler join us today. Jan is the professor of gerontology in the McCormick Graduate School of Policy and Global Studies and the director of the Center for Social and Demographic Research on Aging in the Gerontology Institute at the University of Massachusetts, Boston. And what the center does is they seek to meet the data needs and address the practical questions of concern to aging communities. And they have worked with many communities in Massachusetts to develop community needs assessments in supporting COA planning and age-friendly initiatives. They also produce the Elder Index, which you'll be hearing more about today. And Professor Mutchler conducts research on socioeconomic, cultural, and family-based factors as they relate to outcomes central to well-being in later life, including health behaviors, and family relationships. Professor Mutchler is a fellow at the Gerontological Society of America and serves on the editorial boards of the Journal of Aging and Social Policy and Research on Aging. And Jan, we also work with her very closely on the database project that we conduct with MCOA. So great to have you here today, Jan. Thank you.
Well, thank you. Thanks for inviting me. And I've talked with, some of you may have heard me talk about the Elder Index before. I think that, you know, like everything we're doing these days, we have to sort of rethink what we're doing and what we're talking about. And so I've done that a little bit with this presentation as well. Kathy, can I assume that if there is a question, you'll just jump in and tell me? That would be good.
Yes, that's correct.
That would be great. Yes. So please do ask questions as we go along. We don't need to wait till the end. So I'm going to go ahead and hopefully get started. I have to set it up a little bit so I can see everything I want to see at the same time. Here, hang on. No, maybe I won't. Okay, are you able to see my screen now? Yep. Yay, success. Okay. All right. So we're going to be talking about the Elder Index, about economic security in general. This is something that we work on a lot in my center at the UMass Boston and the Gerontology Institute. So we're going to be talking especially about the Elder Index, which is a cost of living measure for older adults. But before we do that, and I hesitated about putting this picture on. I thought, I'm really so tired of seeing this picture. And yet it's become sort of the logo or the iconic sort of image of the times that we're in. And so I think that, as I said, we need to cast or at least rethink everything we're doing, everything we're talking about with respect to the times we're in. We've heard so much about the impact of the infection on older people and their families. We know the statistics about how age and different race and ethnic groups and different places are being differentially impacted by that. But we're really, I think, just beginning to hear more about what we think about as the fallout impact of the COVID-19 situation. Essentially, what else is going on? What are the things that happen to older people, not even independent of their becoming ill, but rather just all the economic consequences, all the inequality consequences, all the things that are going on ancillary to the disease itself. And so we're starting to do that work at UMass Boston, and I'm going to share some of those thoughts with you. We know that a lot of people have lost their jobs because of the economic downturn. Businesses have closed, people have had their hours cut, and that has extreme economic consequences for people and their families. And older people are caught up in that as well. You know, again, the things that we hear in the media often is about younger families and the consequences for them, but there's a lot of implications for older people as well. So I'm going to return to some of those issues, but first I am going to talk about what we were meant to talk about today, which is the Elder Index and economic insecurity. So I'll just tell you a little bit about the Elder Index, which again is this cost of living measure, this tool that we've developed and that we produce and push out at UMass Boston. I'll give you a little bit of information about the 2019 Elder Index for Massachusetts, and we'll talk a little bit about how economic security and cost of living varies across Massachusetts. And then I'll show you our website, and we'll talk a little bit about what COAs can do to support economic security. And I think you guys know more about that than me. And so hopefully we'll have a nice conversation about that at the end. But I want to start with a real life story. Here's the image that was included in an article in 2017 when the Boston Globe wrote about this person. Her name is Judy Gorsuch. She's 74 years old. She lives in Boston. And she is one of the 300,000 Massachusetts residents age 65 and over who struggle to pay their bills. They were actually talking about the Elder Index and the work that we've done within the context of her personal story. Now, the story explained that this woman has a college degree. She worked all of her life. She was a flight attendant. She worked in a library. She had a series of jobs, and she took care of herself financially all of her life. But now she lives in public housing. She relies on an annual income of just about $22,000, which is mostly Social Security and a small pension. And the article says, I have to move my pictures here. The article says, between rent and groceries and medical costs, she says she's lucky if she has any money left at the end of the month. When a new prescription for a bladder condition upped her expenses by $55 a month, she stopped filling it. So that's how tight she's living. And that's how tight a lot of older people are living. And I know you know that because you see them coming through your door every day under normal circumstances. So Judy really doesn't have many strategies for bridging the gap between her expenses and her resources. She can't work. She's lucky to have a housing subsidy. The only options she has available to her, the only thing she knows what to do when she has that kind of unexpected expense is to make unhealthy choices. She cuts her food consumption, she forgoes needed medical treatment. So this is really the focus of the work that we're trying to do on elder economic security and with respect to the Elder Index. So when we think about economic security, the way we conceptualize it is as a balance between resources and expenses. And so resources, really are meant to just capture the kind of financial money that one has. And we have a lot of data on that. You know, one can quibble about the quality of some of those sources of data, but we have good information on them, the income that people get from Social Security and earnings. We have pretty good information on pensions, things of that nature. So we have a way to measure older people's resources. What we struggle with is figuring out what are those expenses? What should those expenses be? And so that's what the Elder Index is trying to do, is to generate essentially a budget. What older people need in order to get by, to stay in their homes, to stay independent. So we make that calculation based on existing data. We do it in order to measure the level of economic security that older people have. We focus on geographic variability. in the cost of living and as a mechanism to figure out where is economic insecurity worse and better in different locations around the country. And it also lets us evaluate the success of programs that are meant to reduce disadvantage, because it can really help us envision when people do have a gap between their resources and their expenses, what are the programs that fill in that gap and how effective are they? So the Elder Index then is a resource used to measure the income needed by older adults to maintain their independence and meet their daily living expenses. And the main features of the Elder Index is, again, it summarizes how much it costs to get by. The focus is on getting by. The focus is not on being able to replicate your standard of living prior to retirement, which is a lot of people talk about security in those terms. Financial planners will talk about security in those terms. We're looking for a different threshold. We're looking for a threshold where people can really just stay in their homes and get by. We build the Elder Index around everyday expenses that older people encounter. So we literally do create and calculate a budget for that. We assume no needs-based supports or transfers, and so we assume that people have to pay their rent or their mortgage, their housing expenses out of pocket. They have to buy food. They have to pay for their medical care in terms of co-pays and insurance. It assumes that people are living independently, and we calculate it county by county for the entire United States. And that's one of the most unique elements of the Elder Index, is it really lets us summarize how in different locations older people are experiencing different costs of living. And that has to be factored into our thinking about economic security. So let's turn then to the 2019 Elder Index. Okay, so before we look at the numbers, I just want to show you where the numbers are going to be, so it's not quite so numbery all at once. So we calculate the Elder Index by filling in this matrix. The budget is really that far left vertical column over here. This is the budget that we're trying to estimate. We estimate how much does housing cost, how much do people have to spend for food, for transportation, for healthcare, and then for a miscellaneous category. We calculate these things for 3 different housing statuses. What would housing cost if they had paid off their mortgage? What would it cost if they were a renter? And what would it cost if they still had a mortgage? We calculate it separately for older people living alone and for an older couple. And there we're just talking about a 2-person household and both people are 65 and over. Okay, so it's just 2 older people living alone. Most of them are married, not all of them are married. And then we actually also stratify it by health status. We calculate it for 3 different health statuses. Everything I'm going to be showing you here today assumes good health, but we also calculate it based on excellent health or in poor health. Okay, so once we put the numbers in, this is what it looks like. Now this is the Massachusetts average. As I said, we calculate this county by county for the US, okay? This is just a weighted average across the counties in Massachusetts. And so we can say, well, on average, this is what it costs to get by in Massachusetts. You can just see that we fill in the numbers across here. Our estimates of housing come from the US Census Bureau and from HUD, Housing and Urban Development. Our estimate for food is based on USDA food budgets. Transportation is something that we calculate from a large database about transportation expenses. Our healthcare estimates are from the Medicare website, and miscellaneous is just an inflator that we use to capture things like clothing and other things that are not included. And you can see this is as I said, it's a very stripped down budget. You know, whenever people look at this budget, and typically they say, can people really live on that? Is that really something that people can get by on in where I live or in my state or in my county? So it really is a very limited budget. But as I'm going to show you in a minute, it provides a much more realistic estimate of what it takes than what we are usually using, which is something around the poverty line. Okay, so these are our numbers for Massachusetts, and just to give you a visual that helps you look at that a little bit more clearly, I've put the totals here for single people in a chart. So you can see here we've got Massachusetts on the left. We've got our 3 housing situations here, and we've just stacked up the budget for the different expense categories. So we've got housing being this dark blue, and we've got healthcare, food, transportation, and miscellaneous. And you can see it sums up to about just over 25,000, around 26,000 for owners without a mortgage. In Massachusetts, renters is higher, owners with a mortgage is higher. On the right, I put the US average just so you could begin to get a sense of that geographic feature, because again, that I think is something that's really important and kind of unique about the Elder Index, is it really lets you summarize how much does it cost to live in this place as opposed to other places in the same state or across the country. What we see here is obviously that Massachusetts is much more expensive to live in than in the US as a whole. Now, we know that. You know, we live here. We pay our mortgage, we pay our rent. So we know those things intuitively. But what's so striking is a lot of the conversations, I would say most of the conversations we have about older people and economic security says nothing about cost of living. It's just not even on the radar. And so much of what we think about with respect to older people and incomes and economic security has to do with how much, how much Social Security are they getting? That's a lot of money, you know, from a standpoint of a federal budget. How much are we paying for Medicare? That's a lot of money. And so we really don't have we haven't had a good way of summarizing how much it actually costs to get by and how much the resources that older people have available to them take them toward being able to cover their necessary expenses. So here we see again that clearly the cost of living in Massachusetts is much higher than in the US. And the other thing, if you sort of take a really close look about this, you'll see is that a lot of this story is about housing. A lot of the variability, at least with respect to the difference between Massachusetts and the US, is about the cost of housing in Massachusetts being so much higher than it is in many other parts of the country. That's where we see a lot of the action in terms of different cost estimates in our work. But the other piece is also healthcare. Healthcare can be quite variable across different locations in terms of how much it costs. So for the most part, what we're talking about in the geographic variability story is about housing and healthcare. Now, when we turn our attention just to Massachusetts, we also see a lot of variability, and I don't break it all out in the different components because it would start looking very busy. But this gives us the Elder Index for counties, and again, our focus is on single renters in good health. And you can see that in every county in Massachusetts, the cost of living, the value of the Elder Index is higher than the US average, right? So the US average is just over $25,000. The lowest cost county in the Elder Index is Hampton County, $26,000, okay? So there are some counties in Massachusetts, and clearly it's more the counties in the western part of the state, where the cost of living is not substantially greater than the US average. But there are also counties in Massachusetts, up here really in the greater Boston area, where it's substantially more. And so again, when you think about talking about what do older people need to get by, even just in Massachusetts, it really depends on where you're talking about. Are we talking about the Boston metro area? Are we talking about on the Cape, Barnstable County? Are we talking Plymouth? That's where I live, in Plymouth County. Are we talking here? We're talking out in Worcester. It's very different depending on where people live in terms of what they really need in order to get by. But again, in every county, the cost of living is higher than in the for the US average. And so that once again points how, conversations about how much it costs older people to age in place that are based on US averages often really don't apply to a lot of people, particularly people living in high cost areas like Greater Boston. Okay. And then the other point that I want to make, and getting back to sort of, the whole threshold issue, a lot of the conversations that we have about the adequacy of older people's income is based on the federal poverty line, the federal poverty level. And if you work with poverty metrics at all, you know that the federal poverty line is really, really low. For a person living alone, it's just about $12,500. So it's very low. And intuitively, we know that that's not enough to get by on. And so for some programs, we'll say, well, we're going to raise it. We're going to have it's 133% of the federal poverty line. It's 150% of the poverty line, something like that, to just sort of try to adjust that. That doesn't take into account the variability across locations in the cost of living at all. And it still finds us well short in many cases of what it takes to get by. And so any kind of conversation that really is anchored on the federal poverty line is going to be anchored on a threshold that's just way too low for adequacy. So you can see for all of the counties in Massachusetts, for the US average as a whole, and in fact, in virtually every county in the entire United States, the federal poverty line is well below what the Elder Index says people need in order to get by. Okay. So we've been talking about this measure, this metric, which is the Elder Index. And oftentimes we can use that just as a piece of information to explain to people, this is how much it costs to get by. This is how much it costs to pay your bills in this county, in this location, in this state. But in addition to using it just as a descriptor of that, we can also use it in order to evaluate how much economic insecurity do we actually have in our community, in our county, in our state. And so to do that, we have to compare the economic, the cost of living as conceptualized by the Elder Index with how much money people have, returning to that balance and seeing, are people by and large in balance or are they not? One way we can begin to conceptualize this is with reference to the Social Security benefit. Now, we know that most older people have Social Security. Most of them are eligible for Social Security. And so this is certainly the most common source of income that people actually do have. One way we can think about using the Elder Index then is to create a measure that tells us how far does Social Security go towards covering your expenses. So in this figure, we see the ratio of the average Social Security benefit for a retired worker to the Elder Index. And in both of those cases, it's for that same county, okay? So the Social Security benefit on average actually varies quite a bit across counties as well as cost of living. So we can take both of those pieces and we can generate the ratio, and this is what we come up with. So for instance, in Hampshire County, the average Social Security benefit is $17,387, and the Elder Index is $26,328. And so the Social Security benefit covers about 66% of the cost of living. And that's the highest it goes in Massachusetts. The gap is about $9,000. And so in that situation, the person living on the average Social Security benefit in Hampshire County needs about $9,000 more than what they have for Social Security in order to cover their expenses based on the Elder Index. If they live in Suffolk County, Social Security is only going to go 44% of the way. They're only going to cover half their expenses in Norfolk County. So this is a way to very quickly visualize what's the gap between Social Security and what people need in order to get by. If we want to sort of expand the scope of what we're looking at in terms of income sources, we can reflect on this figure. So we talked before about the federal poverty line being way down here. It's a very low threshold of what people need in order to get by. And we call the people below that threshold poor. those are our federal poverty statistics, or people who have less than that $12,500 a year to live on. What we're arguing here is that the elder index is a more realistic threshold for economic security. And so people who have income below the elder index, we would say those are people who are economically insecure. All right. And there are people who fall in the gap between the elder index and the poverty line. Those are the people that aren't really measured in our poverty statistics. And those are also people who, if the threshold for some kind of support is the poverty line, those are the people who really don't have enough to get by, but they're not eligible for those supports, right? So they're really missing. Those are the folks that are really struggling. They don't have access to a lot of subsidies or supports, but they don't have the money to pay out of pocket for what it really takes to get by. So that's really a big part of our focus of our work, is really trying to capture and pull back in those folks who are in the gap. In Massachusetts, when we do that, when we calculate focusing just on people who live alone or people who live in a 2-elder household, and trying to figure out, well, what does it take for them to get by with respect to the elder index, and then how many of them have that much money. This is the figure that we come up with. When we're looking at couples over here on the left, we see that people age 65 and over living with just one other person who's also 65 and over, in that situation, you only have a 5% poverty rate, all right? You only have 5% who fall below the poverty line for older couples, for 2-person household, okay? So if that were the end of the story, just think about it. You know, we'd be saying, it's 5%. What do you expect? That's great, you know, and that would be all we need to know. But in fact, another 25% of older couples have income in the gap. They're not poor, but they can't cover their expenses. All right, they're below the elder index. So that gives us a very different story about the kinds of economic struggles that older couples are having in Massachusetts. And it's a high number, and it's a big group of people. On the right, when we look at older singles, we see a lot more economic insecurity. 18% of older singles living alone are poor. So they're below that 12,000. I keep saying that number because it's just, you know, unbelievable that that's the threshold that we use for a lot of these measures. But 18% of people who are living alone in Massachusetts, age 65 and over, are poor, and another 44% are in the gap. And so you've got more than 60% of older singles living alone have incomes that fall below the elder index threshold. So when we put those into numbers, we estimate that about 183,000 singles and another 117,000 people living in older couple households have incomes below the elder index in Massachusetts. So we're looking at about 300,000 people who live in one of these housing situations, age 65 and over, and they are struggling to get by. The last data point that I'll share with you is this one, and it just looks at this same split in terms of below the poverty line and in the gap across different regions of Massachusetts. So this is just focusing on singles, and again, we're focusing on people who are in good health, or the measurement based on good health. And so you can see quite a lot of variability even just within Massachusetts. And again, remember that this is a calculation based on how much does it cost to get by, the elder index, and also how much money do people actually have in these different locations. So the way it balances out is what yields these numbers. We find in Barnstable County is where singles do the best. Okay, they do the best in the sense of their poverty rate is pretty low, and once you add on the people in the gap, you've only got 51% of singles who are falling below the elder index. So those are the 51% economically struggling. By the time you get up here to the Boston metro area, you're looking at 64%, so a much higher share. So there's a lot of variability, not just in the resources that people have or in the cost of living in the locations where they are, but also when you pull those together, a lot of variability within Massachusetts in terms of how those things weigh out and how many people are struggling. Okay. So I wanted to just show you some images of our website. I decided not to be brave and try to actually run it while we were going, because who knows what would happen. So I just grabbed some screenshots, and I just wanted to share with you what it looks like so that you would know how easy it is to go in and look at it yourself. So this is the opening page. If you go to elderindex.org, you'll see this page, and this is the opening page of our website. All of the data that we have about the Elder Index and those numbers about how much does it cost to get by are in this website, and anybody can go to it and they can use it for free. We're finding that a lot of organizations are using this, both to sort of compare for themselves, what about my county versus some other county. A lot of people frankly send it to their mothers and say, you know, you're wanting a retirement move, why don't you shop around for some place that's lower cost of living. So there's lots of governments use it. There's a lot of use of these data, but it is very easy to use. So this is the opening page. And you can see what you do is you type in here, you start typing, and the drop downs appear. You can choose up to 4 counties and or states. And so you can choose your location. You decide which dimensions you're wanting to look at for the Elder Index. Are you wanting to see what it costs for single people living alone or for couples living together? Are you wanting to assume that people are renting, or that they have a mortgage, or that they have paid off their mortgage? They own it free and clear. And what do you want to assume about health status? And then you just push apply, and presto, yep, this comes up. So this is what it looks like when you make that request, and then, as I said, say apply. First, you see this bar chart, this set of bar charts that shows you, you can see that looks very much like some of those bar charts I shared with you earlier. You can see how the costs stack up in terms of you know, the locations that you've chosen, and you can compare them. If this were a functioning website, when I hover over each of these bars, the value comes up. When I click on this mark right here, you can print the image, or you can download the data. So there's a lot of features in there that would let you go ahead and choose the locations you are interested in, pull down the data for yourself, and then either share that with someone or do some additional work or calculations with it if you wished. And then if you pull this website down further, or the web page down further, you get a little bit more information about each of the areas that you chose. So in this case, for Barnstable County, it gives you that monthly Elder Index budget for the county. It tells you what that adds up to over the course of a year. So a single in Barnstable County needs just over $32,000 a year. And it also tells you how much is that relative to the national average. In this case, it says it's 126% of the national average. So it's 25% more than the average location in the nation needs. By the time we get down here to Worcester, we're at 107%. So it's much closer to the national average, but it's still a lot of money, particularly when we keep in mind that 12,500 that is our conventional benchmark for what it takes to get by. Okay, so now with that is, I know we're going to have some questions and some conversations in a minute, but I just wanted to share a few thoughts about what the COVID situation may mean for economic security among older people in Massachusetts. So this figure just is some information that is just starting to be released from the US Census Bureau. They have pushed out a new survey that they're literally doing every single week. They started in the very end of April. And every single week they're doing hundreds of thousands of cases of survey responses. around how the COVID situation and the economic fallout is impacting families. And so there are a lot of older people in that survey data, and there's information for Massachusetts residents. So the information I'm showing you here is for June 4th, the week of June 4th. So it's very current. And we can begin to see what's actually happening for older people. The first bar here is telling us that 26% of the respondents who are age 65 and over during that first week of June said, my household has lost employment income. A quarter of older people in Massachusetts live in a household that lost employment income since the COVID crisis began. 18% say, when I look ahead to the next 4 weeks, I expect my household to lose employment income, okay? 37% said, I delayed medical care for myself because of the COVID crisis, okay? So we begin, and there's a lot of information in here. We're actually in the middle of putting together a little report that we're gonna put on our website that will summarize a lot of these consequences that Massachusetts residents are experiencing. And so I hope you'll look for that. Hopefully in a week or two. But there's a lot of information that really helps us begin to understand that what we sort of knew in our hearts and from our experience, which is that older people are being impacted by the economic consequences of this. But to a considerable extent, if you look at the newspaper, if you look at, watch the news shows, so much of that conversation is about the younger population, the working age population, the population that have kids at home, which is hugely important. But this is important too. And so I think we need to educate ourselves about what's happening for older people financially as a result of this, and begin to imagine what is this going to mean for us and the work that we do with older people, understanding that already a lot of older people are struggling financially, and what is this experience going to do to that? How long is it going to take to recover? How much worse might it be? Some of the things that we know happens to older people and their finances when we have economic downturns suggests that the consequences will be long lasting. We know that a lot of older people work well into later life. A lot of people are still working, certainly between the ages of 65 and 70, and a lot of them work well beyond that. And I know you know some of them in your community. So a lot of people rely on employment income themselves. They rely on their own work income. Past economic downturns tell us that older people often do lose their jobs. In this case, the data that we're seeing out of the U.S. Department of Labor suggests that older people are experiencing unemployment rates that are as high or higher than younger people, which has never happened before. It literally has never in the history of the United States happened before. Older people have traditionally held on to their jobs a little bit better than younger people, but that's not happening in this situation. So we know that they're going to be experiencing employment. Many of them are going to have cutbacks in hours or are experiencing cutbacks in hours. And what we know from past downturns is that when older people lose their job, they find it much more difficult to find a new one. Okay? They're unemployed for much longer periods of time. And some of them, many of them, drop out of the workforce permanently. So we might talk about them as discouraged workers, or we might just say, well, they decided this is for the birds, I'm just going to retire. But we know that that happens, and we expect that that's going to happen in this situation as well. We know that to the extent that their retirement assets are impacted, either their savings or their IRAs or whatever they have available to them, depending on what happens long-term with the stock market, those kinds of losses may impact economic security. One of the things we know from past downturns is that the intergenerational financial issue is very important with respect in terms of what happens. Some older people do depend on their children for some income. Usually it's not a whole lot of money, but for some families, it makes a big difference in elder financial security. To the extent that older people's children have lost their jobs or experiencing financial struggles, that income flow is going to be disrupted. And what we also saw in past downturns. I'm referring really to 2008, we saw a lot more intergenerational households being created. So a lot of people who the parents were struggling financially, the adult children were struggling financially, and they moved in together. And a lot of times those households never became disentangled again. So we can expect that may occur. One of the things that we've seen to be a big issue for older people in recent decades is the accumulation of debt. We can expect that will happen again, and that will perhaps be much more problematic in the current crisis than it has been in the past. And the other point that I'll make is that, you know, when all of these things happen, when people lose their jobs or they have cutbacks in hours, they really aren't able to maintain their income from whatever source that might be. Some of them might end up taking early Social Security. They might decide, well, I'm only 63, but I'm going to go ahead and take Social Security, right? Plan to wait until I was 68, but I'm going to go ahead and take it now, even though I'm only 66. And we know what happens when people take early Social Security is that income loss is permanent. They never recover from that. So with all of those things in mind, we can expect that this disruption, especially since it doesn't appear that it's going to be brief, is going to have long-term financial implications for older people. So that really means that all of the things that you already do in terms of trying to help older people in your communities make ends meet, apply for benefits that they're eligible for, figure out what they need in order to get by. All of the work that you do around that, I think, is going to become even more important than it ever was. And you may see more demand for help than you ever saw before. So very briefly, just turning to what are some of the things that I think you might be able to do. I think one of the things that we found with the Elder Index is it's really a useful educational tool. One of the things that people, I think everybody experiences this, but you know, in our work, it's become real clear that older people are very likely, if they're struggling financially, they're very likely to just look to themselves and say, what am I doing wrong? Okay, so they take it on themselves and they blame themselves and they say, I'm not managing my resources very well, I need to cut back. And I think being able to educate older people about how much it really takes and to make them understand that it's not just them, I think that in and of itself is actually helpful in a way that the Elder Index in particular might be helpful to you. I think educating your community members about the benefits of the services that you already have in place at your Council on Aging can be helpful. One of the things that I'm always surprised about, we do work with a lot of councils on aging, and I think about all the benefit that councils on aging bring to a community by helping older residents apply for benefits that they're already eligible for and that don't cost the town anything. You know, it really is just a huge service that these kinds of programs are making available to residents. And so I think helping people understand what those programs are and that, yes, you know, you're entitled to this, I think is educating people about that, I think is something really important. I know you already do it, but I think it's going to be important for you to do even more. I think there are some things that community can do in terms of property tax relief and transportation, advocating for affordable housing, educating residents about programs and supports around healthcare. I think there are things like that that can also be done that can be very important, and a lot of that can be done through partnerships. I know that a lot of you work with your veterans agents and other organizations within your community, but to the extent that you can partner with other groups in your community to get the word out and help people understand what it takes to get by and what are the resources available to them. I think that's all a good thing. Then just general advocacy, whether it's at the community level or the state level or even the national level, to really do what you can in order to make sure that people understand how much it takes for older people to stay in their homes and how things need to change to make that better. So that's my presentation, but I would be interested in hearing anything you all had to say, any ideas that you had to share with me or with each other about the economic security issue and what could be done.
Jan, thank you so much. I have a question. As you were talking about the federal poverty level and the gap, are there statistics around that can actually measure what impacts SNAP and the other market basket of benefits can do to help bridge that gap?
Statistics around, you know, and that's one of the, almost the, I hate to phrase it this way, but sort of a marketing of those kinds of programs is to say, this is how many people are lifted out of poverty by this program, okay? So some of it is the actual lift out, and it is substantial. We haven't done that with the Elder Index. That's something that I think we clearly need to do. But it's a little bit challenging. But the important side of that is that there's the sort of the theoretical story about how if everybody who was eligible for SNAP or fuel assistance or whatever applied for it, this is how much more secure older people would be. But there's a big gap, as you know, between the people who are eligible for it and the people who actually do it. And so that productivity of those programs is far less than it could be. And I think that's why the communication piece and the outreach is so important, because the programs are there to make a big difference. But so many fewer people take advantage of them than are actually eligible. So I think there's a lot of work to be done both on strengthening the programs and measuring the impact, but also on the communication and outreach is huge. Yeah.
There's been a couple of questions about the availability of the PowerPoint, and I've let people know that we will have it posted on the MCOA website for people to take a look at.
Great, great. That's terrific. And you can also go on this last slide, and when you go to the MCOA website, you can look at this slide. And, you know, we have the Elder Index org is where the data itself, those Elder Index values are. But we also have a bunch of stuff on our website, reports and figures and maps and things like that. We're just now continuing to, I'm looking at Brenda's friend here. I know. I called him out. We have a lot of things on our website that might also be helpful to you. Again, I think in terms of communicating with other stakeholders or with residents, it's always helpful to have a figure, a map, something that will really speak to different people based on how they understand things. So a lot of that material is on our website. We are continuing to produce things based on the 2019 Elder Index, and so there'll be more stuff on our website over the course of the summer. But at any time, if you have any questions about it, if you're looking for something in particular, just email me, and I'm happy to send you what I have.
Thank you, Jan. And there's an observation that you had good points about part-time jobs going away or folks not returning to work and the intergenerational entanglement of finances.
Yeah. I think that's really important because, I mean, I know from my work with older people, I know that you run into it as well, that a lot of times what impacts older people in terms of their finances, their living situation, their stress levels, their health, has a lot to do with what's going on with their kids, right? And what's going on with their grandchildren. So families are all tangled up into pretend that older people are just completely independent actors is just not understanding how the world works. And so I think reminding ourselves of those elements and thinking about how is everything that's going on in the world and in people's networks impacting the well-being of older adults right now. Thank you for that.
And I do not see any more questions in the chat box. I don't see anyone except for you, Jan, on my screen.
Oh,
So I don't know if anyone is
I see
raising
one
their
now.
hand.
Well, I would say if anybody has anything that they do in their town through their COA or things that they've seen working in your community that you thought could be replicated, or just that you thought was helpful in terms of economic insecurity, I think that would be great to share if anyone has good ideas.
So thank you all for joining us today. Jan, always thank you so much for the fine work that you do. And okay, so other folks are saying thank you, and we will have a short break, and the last session will begin at 2:15.
Very good. Thanks.
Thank you.
Take care, everybody.
Thank you.